This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right.
So hey everyone, we can't see ourselves, but hopefully you can still see our smiling faces in the corner of your screen. We are the chief residents at the University of Penn PM&R program. My name's Taylor. I'm the administrative chief resident. I'm a PGY4, and I'll let our other chiefs introduce themselves as well.
I'm Ben. I'm one of the academic chief residents.
And my name's Palak. I'm a PGY3 and I'm junior chief this year.
All right, so Palak's going to monitor the chat while we just go ahead and get started with the presentation. So here we are. This is University of Penn PM&R. We're again located in Philadelphia. We have 24 residents, 6 PGY4s, 6 PGY3s, 6 PGY2s, and then 6 interns. 4 positions are categorical, meaning that you would do your intern year here at University of Penn before continuing on as a PGY2 resident. And 2 of our interns would do their prelim year elsewhere and then join us in their PGY2 year. These are just some of the photos from recent events that we've had. So here is a quick slide about the rotation sites. All of these are located in a pretty reasonable radius within Philadelphia. Most of them are walkable. If you enjoy walking, definitely bikeable. And we have a great public transportation system here in the city to get us to all the places that you need to go. So there's a little bit more about living in Philly later on that I'll let one of our other chiefs tackle, but essentially you definitely don't need a car to do residency here. So the first picture is our actual standalone rehab hospital. That's Penn Medicine at Rittenhouse. And that's where we have majority of our inpatient rehabilitation rotations as well as our outpatient clinics. The second photo on the top row is the VA Medical Center, where we actually spend 2 months of each year from PGY2 to PGY4. And it's definitely a privilege to rotate at the Philly VA Medical Center and work with our faculty over there and take care of the veterans. The third picture on the top is actually the oldest hospital in the country. That's Pennsylvania Hospital. If you do your categorical intern year with us, you spend about half of your year rotating at Pennsylvania Hospital along with their internal medicine service. And when you become a PGY2, you will do consults at this hospital and some random days of consults as a 3 and 4 if you're covering the PGY2s. But we spend a lot of time at Pennsylvania Hospital, especially if you're a categorical resident, and we really love rotating there. The first photo on the bottom row is CHOP, or the Children's Hospital of Philadelphia, a very, very well-known children's hospital in the country. We rotate there as a categorical PGY1 and as well as a PGY2 and PGY3, doing, you do rehab medicine consults as a PGY3 and as a PGY2, excuse me, and as a 3, you'll do inpatient peds, which is a brand new rotation as of last year, and we really enjoy that. Then we have the second photo on the bottom row is our level 1 trauma center. That's Penn Presbyterian, where we'll also do some acute care consults. And then finally, we have the brand new flagship hospital, which is the Hospital of University of Pennsylvania, multi-billion-dollar facility that was built recently. It looks like a spaceship. We spent a lot of time there doing consults, and that's where you're going to get the majority of your neurosurgery, your cancer patients as well. And here are just some of the outpatient sites. There's the Perlman Center, which is right next to our large flagship hospital, 3737 Market Street, which is where we do a lot of sports medicine rotations and EMG. And then the beautiful historic Franklin Field, where there's clinics attached where we do also sports medicine and see a lot of the Penn medicine athletes at that location as well. If anyone is, a track fan, the Penn relays are held at Franklin Field, and it's really a privilege to rotate there routinely as a part of our residency. As I mentioned, the rotations are all centrally located. There's something else on this slide. No. Centrally located. You can see one of the stars there, Good Shepherd Rehabilitation Center. That's essentially where our rehab hospital is. And there's more about this slide later in the presentation as well, showing kind of where residents tend to live and where our rotation sites are. So as I mentioned, we do have a categorical track for 4 of our PGY1 residents. And this is just an outline of what that looks like. It's essentially set up like a transitional year, and you guys can feel free to chime in at any point. I'm trying to just I'm rattling things off here. You'll do a month of general surgery, month of neurosurgery. And it's really nice to rotate through these surgical rotations. You're of course not going to the OR, you're more managing patients on the floor, but it's nice to kind of work side by side with a lot of these residents and attendings that we will ultimately share a lot of patients with when you move on to your inpatient rotations as a PGY2. We also get your medicine foundations, working with the family medicine team and the internal medicine teams, like I mentioned, over at Pennsylvania Hospital. We do neurology consults for a month, really nice rotation where you don't work nights or weekends. You just get really, really good at your neuro exam and comfortable with the stroke alert and things like that. As I mentioned, you'll do a month at one of the top pediatric hospitals in the country, working side by side with their residents and learning from those attendings. That's really valuable experience. 2 months of elective and roughly 1 month you'll spend with us at the rehab hospital. Then as a PGY2, again, this is just running through what the year looks like. We do peds rehab at the Children's Hospital, 1 month of outpatient and 1 month of inpatient consults, which is actually pretty nice, I think, because so much of adult consults tends to be dispo, whereas at CHOP, it's almost never dispo. It's usually, managing autonomic storming, dysautonomia, like true rehab consults, and really feeling like you're contributing a lot to the acute care of these patients over at the Children's Hospital. Also, you get a ton of spasticity management and Botox, backlift, and pumps, you name it, at CHOP. You also will do the bulk of your inpatient rehab rotations as a PGY2. We have a medically complex service, we have a stroke and amputee service, and we have a spinal cord injury inpatient service that you'll rotate on for 2 months each. Then you also spend 2 months on inpatient rehab at the VA. And as I mentioned, Pennsylvania Hospital, you'll do consults as well as some half day of general rehab outpatient clinics. Then as a PGY3, you'll do another 2 months of inpatient medicine on the traumatic brain injury service and 2 months of inpatient rehab at CHOP. As I mentioned, that's about 2 years old now. And it's really a nice perk to get to rotate and actually care for patients, pediatric patients on the inpatient side. And then at Hospital University of Pennsylvania, you'll do 2 months of consults. Penn Presbyterian, which is the level 1 trauma center, 2 months of consults. You'll do 2 months of VA outpatient clinics as a PGY3. And a lot of us really enjoy those 2 months because they're very procedure heavy. If you haven't cared for patients at the VA, it's very unique experience, great time working with those patients, and definitely a unique patient population there. You also have your first elective, and you'll do a senior inpatient rotation as a PGY3, where you're more on the, you'll have a couple of inpatients, but you're mostly there to be a resource for the younger inpatient residents. And it's a really nice rotation where you get a lot of work done, but you're still getting to see some inpatients and take a more senior role on the team. Then finally, as a PGY4, very heavy outpatient rotation. Great chance to work with our very, very strong outpatient clinics. We have rotations through the spine clinics, cancer, pain, sports, neurology, neuro rehab, and general rehab. Most of these rotations take part at the rehab hospital, but also at Pennsylvania Hospital and over near the trauma hospital as well. You do have one more month of inpatient, which is again more in the senior role, and you're more overseeing patients. You're not really signed in as the primary for many patients, but again, just being a resource for the more junior residents, and it's a really nice rotation. We do get most of our EMG in our 4th year. We do 2 1-month blocks and have no problem at all surpassing the EMG requirement for residency during our 4th year, along with the EMG exposure that you get during your 3rd year as well. 2 months of outpatient at the VA, again, very, very procedure heavy, enjoyable 2 months for everybody. And then we have 2 more electives in PGY 4 year. This slide just shows some potential electives that residents have done in the past. Kind of the sky is the limit as long as it makes sense to you and it's relevant to research and relevant to rehab and pertinent to your development and your career, then we can usually make any elective work. And then I know a lot of people are definitely interested in learning about our call. I think our call is very similar to other programs. It's front loaded. We do have in-house call, which means that you stay overnight in the hospital after working your normal day. The benefit of having in-house call though is that you do get a post-call day, meaning the morning after you're on call, you have that entire day free of clinical duties. And in-house call at our rehab hospital, you're carrying or you're signed in for about 60 patients would be the max. And we typically get at least 4 hours of sleep whenever we're on call. So I don't know.
Yeah, I'm on call right now and I'm clearly part of this, so it's not that bad.
Yeah, so the post-call day actually ends up being pretty nice if you're able to get some sleep. As you go on and progress in the residency, you have fewer call. And by the time you're at PGY 4, you have no weekend calls whatsoever. And then during PGY 2 and 3 year, we do take home call, which does not include a post-call day. But our home call at the VA is much more chill. We have fewer patients on the inpatient service there that we're responsible for. So there's many, many nights where you're on home call at the VA where you don't even get a single call. And again, kind of flying through all this information just in the interest of time, but we are all more than happy to answer any questions that you guys have about this. With that, I'm going to pass it on to Ben, our education chief.
All right. Hey, everybody. So yeah, we'll kind of just go through some of the resident education curriculum and then didactics schedule. All right. So we have didactics every Wednesday from 9 a.m. to 1 p.m. And then within this, we have a monthly journal club. So once a month, one of the residents will pick an article, have a mentor, and kind of go through something they're interested in. And this 9 to 1 p.m. is all protected time. So we have a nurse practitioner who is in the resident room that signs in for all of our patients. So you should not be getting bothered during this protected education time. And then during our kind of didactics, we go through both board review, so we'll have resident-led lectures, attending-led lectures, and we go through different modules. So we'll go through the MSK module, neuro module, SCI, and then we'll have our research team kind of come in and go through how to review scientific literature and various things. So we kind of cover as much as we can, and then obviously we try to make some sessions hands-on as well, just to practice our exam skills and procedural skills. And then we get free lunch during this, which is very important. All right. So this is just an example of our didactic schedule for the MSK module. So we'll have 4 different sessions per week. So just the first one, so kind of we'll have a couple lectures from a physical therapist, and then a QI workshop, which is with the residents, and then a board review lecture led by one of the senior residents. And we kind of just go through different things throughout the block and try to mix in as much kind of different stuff as we can. All right. And then other like extracurriculars. So we have an ultrasound course that we usually have some attendings come and lead. And then sometimes we just kind of have residents go over and practice in the outpatient clinic and just go through different joints. And, you know, we can bring some of the procedural equipment over there and just practice our like needle driving skills and things like that. And then I think probably our biggest thing is our anatomy course, which is during the summer on Thursday nights. So Dr. Vazadevin, one of our sports med attendings, will lead this, and we kind of go through each system and kind of go through the cadaver and then physical exam skills. And it's really nice course actually to have. And then usually go out and get some like beers after. And then just like some other things. Yes, we'll have like practice with just EMG and just kind of really whatever else senior residents are interested in teaching or junior residents are interested in learning about. And then, yeah, with the other programs in Philly, we kind of have a few different courses. So with the gait orthotics course in December with Temple Moss, and then January, February, we have the EMG course with Jefferson. We usually have the ultrasound course, which has been kind of on hold with COVID, but we're hoping to get it back actually this year. And then we also do the prosthetics course here in May.
5 minutes remaining.
Yeah, so then just as far as some fun, so yeah, we get a few like $600-700 a year for like education money, and then we get our board review course paid for. We get funding to present at conferences, and then education days when you're 3 and 4, and then our AAP and AAP PM&R enrollment is paid for. This is Taylor. She just threw this in for herself. I don't know why, but yeah, we have a pretty good research curriculum. Like if you're interested in it, we have really good support from we have a statistician, and then a few of our faculty members are really interested in helping out residents and trying to get something published while you're here. All right, and then we have a few, actually a ton of different fellowships here. So we have sports and spine, sports medicine, pediatric rehab, cancer rehab, TBI. Yeah, I think the only thing we're missing is SCI, but we really have anything, people are interested in, and it's really good, to get connections early on and things like that. And then sports coverage. So yeah, we have a lot of different things. You can kind of do whatever you want here, whether it just be like sideline coverage or kind of going to some of the college games, and then even just what else do we have here? Yeah, like the Penn Relay. So really whatever you're interested in, you can kind of find some way with the sports attendings or just volunteering to go help out.
And okay, and the last couple of minutes we'll just talk about we have a leadership and quality improvement track if you're interested in. Some of us have done this. So Taylor did this last year. I started this year, so we could talk about this later. But then really quickly, I just want to talk about living in Philly. I can pleasantly say that I was surprised at how much I enjoy Philadelphia. So this right here is just showing where all of our sites are. So the radius is pretty small, like Taylor was saying earlier. This is where everyone lives. Some people live out into the suburbs a little bit more, if that's preferred, but a lot of us live here. There's so much to do in Philly, so many good food spots, so many historic places that you can see. What else? We have I think that's soccer you guys are playing up there in the corner. We do happy hours and a bunch of different things. There's also a ton of professional sports here. I'm the last person who should be covering this slide because I'm not into sports, but we have the Phillies. We go watch their games pretty often. The Eagles games, Flyers, the Unions, and of course the Sixers. So we all get free tickets every now and then and try to go as a group. And then of course we do have wellness built into our curriculum. So whether it's just something casual, like getting a bite or drink together. We did go on a ski trip last year. We were hit by the Croc epidemic last year, so we all bought Crocs for some reason. We do Secret Santa and a bunch of other things like apple picking and retreats that are funded by the department as well. And of course we do have recreational sports that we do.
2 minutes left.
And then where do our residents go? So I would say that a lot of us who do decide to go into fellowship do match very well and are happy about where we end up. So I know last year we had a couple folks who went to Stanford, Mount Sinai, And some people stayed here at Penn as well. So people match where they like to go. So that's really good to know when you're thinking about your training program. And then lastly, this is something new. So Penn Medicine actually did vote in a resident union. This happened this past May. Our contract is still pending. So right now we don't have many changes that we can really comment on, but we do anticipate that there'll be improved benefits like salary, childcare, parking, meal stipends and stuff. So that's something that you can look forward to, hopefully in the near future. And so thank you for taking the time to listen to us. Please feel free to follow us on social media. A personal little shout out that we did just start a resident run Instagram. So please give us a follow at Penn PM&R Residents. And yeah, feel free to reach out to us. Our emails are up there in the corner if you guys have any questions. Otherwise, we're happy to answer whatever in the chat.
Strong work.
Would we need to apply an interview for the categorical positions and advanced positions separately? No. So you'd just be interviewing at once, and then it's up to you. It's similar to like the other categorical programs. It's just when you're making your rank list, you can rank both of the positions if you're really interested in that said program. And then, you know, you would match at either, but it's just one interview.
Yep.
Thanks, guys.
Thanks, everyone. Sorry we had to kind of rush through that, but we just really wanted to talk about our program and how much we love it.
Oh, we can tell. Thanks so much for being here tonight.